this picture will talk about pediatric peptic ulcer disease. Definition: peptic ulcer are discontinuation of gastric or duodenal mucosa and exposure of submucosa. The etiology divided into 3 causes. Number 1, increased HCl production and pepsin function, mainly single lesion and present mainly in the lesser curve or antrum. Number 2, extragastric pathogenic event, that is maybe stress or drug. Number 3, Helicobacter pylori infection, H. pylori infection, which may predispose to peptic ulcer disease. Increased HCl production and pepsin function occur in a certain condition. Increased basal acid production greater than 15 milliequivalent per hour, or gastrinoma, which is a tumor releasing gastrin. Example, Zollinger-Ellison syndrome, multiple endocrine neoplasia type 1, antral G cell hyperplasia, systemic mastocytosis, basophil leukemia, cystic fibrosis, short bowel syndrome, or hyperparathyroidism. Extragastric pathogenic effect, non-steroidal anti-inflammatory agent, peptic ulcer disease. H. pylori infection. Diagnostic testing for H. pylori infection is not recommended in children with functional abdominal pain, whereas it can be indicated in symptomatic children with first-degree relative affected by gastric ulcer or refractory iron deficient anemia. يعني دول الحالتين اللي نقدر نعمل فيهم H. pylori testing. مش كل العيانين اللي عندهم abdominal pain هنعمل لهم. Clinical manifestations of peptic ulcer disease: either dull aching pain, intermittent abdominal discomfort, usually occurring several hours after the meal, nausea, vomiting, burning sensation occurring shortly after meal, and bloating. Alarm signs or alarm symptoms: sharp abdominal pain, black bloody stools, bloody or coffee-like vomiting, anemia, early satiety, unexplained weight loss, progressive dysphagia or odynophagia, family history, cancer. Differential diagnosis: non-ulcer dyspepsia or functional dyspepsia, inflammatory bowel, cholecystitis. Investigations: either laboratory, endoscopy, radiology, and laboratory, CBC, complete blood count, we cross-matching for blood transfusion if needed or if indicated, coagulation profile, and either the differential diagnosis of the epigastric pain, including pancreatic enzymes, amylase, lipase to execute the pancreatitis, and liver transaminases to execute. Upper GI endoscopy is preferred diagnostic test in the evaluation of the patient with suspected peptic ulcer disease. The patient could be resuscitated and the hemoglobin level corrected. More than 95% of ulcers occurs in the duodenum, mainly in the first part of the duodenum, which is the duodenal pulp, most probably in the posterior wall of the duodenal pulp. And the posterior wall of the duodenal pulp rely on gastroduodenal artery. Forest classification for the peptic ulcer disease: grade 1, jet arterial bleeding; grade 1B, oozing; grade 2A, visible vessel; 2B, adherent clot; 2C, black spot on the ulcer; 3, clean base ulcer. And the incidence of rebleeding is very high with the first grade and second grade. It is picture for the appearance of the ulcer by the endoscopic examination. Radiology erect X-ray to exclude the perforation and contrast series. Angiography can depict the source of bleeding and can help provide needed therapy in the form of direct injection vasoconstrictive agent. In the case of gastrinoma, we help to diagnose it by serum gastrin level, to screen Zollinger-Ellison, and when to suspect this syndrome. Patient with multiple ulcers, ulcer occurring distal to the duodenal pulp, اللي هو first part of duodenum. Strong family history, peptic ulcer associated with diarrhea and steatorrhea or weight loss. Peptic ulcer not associated with H. pylori infection. Peptic ulcer associated with hypercalcemia or renal stones, ulcer refractory to medical treatment, or ulcer recurring treatment, medical treatment, eradication of H. pylori, and the treatment of the bleeding. High risk points أو stigmata يعني علامات on initial endoscopic assessment: active hemorrhage, visible vessel, fresh overlying clot. كل دي risk for medical treatment. Ulcers with a clean base need not treated endoscopically, just medical treatment. In absence of these stigmata, the patient can be discharged on medical treatment في خلال 48 ساعة، يعني يتحط برضه under observation في أول مستشفى. Eradication of H. pylori infection، ودي according to the ESPGHAN guideline. Triple therapy proton pump inhibitor about 1 to 2 milligram per kg per day. Ampicillin on dose 50 milligram per kg per day plus clarithromycin على 20 ملغ per kg per day or metronidazole بدل الكلاريثرومايسين على 20 ملغ per day. الجدول ده من نيلسون بيوضح recommended eradication therapies for H. pylori، وده برضو من الحاجات المهمة. eradication of H. pylori infection في حالات الريكارنت ممكن نستخدم حاجة اسمها sequential therapy، ان احنا بنستخدم البروتون بامب inhibitor plus الامبيسيلين for 5 days then proceeding to الترابل ثيرابي العادي اللي هو البي بي اي والكلاريثرومايسين والميترونيدازول for another. Treatment of the bleeding peptic ulcer endoscopically ممكن نعمل injection thermoelectrocoagulation, hemostatic clips, argon plasma coagulator or combination therapy or acid plus. ويعني الجدير بذكر ان احنا لازم نقول ان العيانين دول قبل ما يدخلوا اي intervention بالمنظار لازم نكون مدينهم ميجا doses of proton pump inhibitor to avoid re-bleeding. وهنا بيوضح لي الرسمة دي in injection دي diluted adrenaline. ممكن برضو الثيرمال الكترو دي الصور اللي جاية دي برضو electrocoagulation. وفي حاجة اسمها hemostatic clips ان احنا بنحط كليب على البليدنج. هي not available يعني كتير قوي لكن لانها مكلفة. الكليب ده نفسه expensive. risk factor that predict re-bleeding. امتى اتوقع ان العيان ده ممكن يحصل له re-bleeding؟ بعد الهيموستاتيك اندوسكوبيك هيموستاتيك ثيرابي ان احنا بنبقى failure to use لو العيان ده ما استخدمش بي بي اي محترم وكان استخدم مونوثيرابي اندوسكوبيك مونوثيرابي او يوز اوف هيبرين بيستخدم حاجه بتزود البليدنج عيان اساسا ليفر ديزيز او هو اساسا كان قبل ما يدخل المنظار كان هيمودايناميكالي انستيبل comorbid illness كان عنده اي امراض اخرى large ulcer and posterior wall duodenal ulcer. زي ما احنا قلنا ان posterior wall هي الفلور بتاعها gastroduodenal artery وده artery كبير وغالبا العيانين دول بيحتاجوا surgical ligation. الاسيد suppression بال H2 receptor antagonist زي الرانيتيدين والفاموتيدين والسايميتيدين والبروتون بامب انهبيتور اوميبرازول بانتوبرازول اسموبرازول والاسمو اللي هو متوفر في السوق اللي هو النكسيوم ولانسوبرازول. ودي برضو جدول من نيلسون للحاجات اللي بتقلل complication of peptic ulcer are obstruction, perforation, penetration, massive hemorrhage, and lymphoma H. pylori. Thank you.